How do we fix the diaphragm? It's easy. Well, not easy, but it's not difficult. Well, like most muscles, first of all, you got to make sure they're firing and working correctly. And then what do you got to do? You got to exercise them. So how do we know if the diaphragm is working correctly? Well, one of the ways we know is if your ribs move out when you breathe, we know that the diaphragm is working correctly, because what happens is the diaphragm moves down and the ribs move out. If there's very little motion laterally in the ribs, we can make an assumption that the diaphragm is not functioning at all, or very little. So we have to address that. And recall, if the ribs don't move, the muscles that attach aren't engaged. So we got to get the muscles that attach to the ribs to engage, but you also got to get the ribs to move to engage. Exercises for the diaphragm are practice pushing your hands laterally, breathe correctly so your stomach protrudes as you breathe. That tells us we're engaging the diaphragm. Practice blowing up balloons. And if you're a good singer, sing some songs, because singing exercises the diaphragm differently than speaking and talking or breathing. So using, or singing I should say, singing songs is a great way to go. Okay, so the 4 muscles at the core, I'm going to give you a real quick review. We've covered these before on how to muscle test them. So first one we're going to use is called the quadratus lumborum. Okay, so you're going to place your hand on their hip. You're going to push their legs away from you, and you're going to slide your hand under their feet. If you don't do that, they're going to push their feet down and try to cheat. So now you're going to tell the person to pull their legs to the left against your resistance. And you can see, actually, have them hold the side of the table so they don't slide, so they can fight you. So hold there, and you can see, even though he's trying, he's got nothing there. So we know that the QL, quadratus lumborum, on the back side that goes from the pelvis to the ribs, is weak. Now you bring it up with 10 degrees, and now you have them pull the same direction to the left. And there's their abdominal. It's a certain division of what we call the oblique abdominal muscles, but it's a weak muscle. So try that again. And most people have nothing there. You're going to do the same thing going the other direction to check both sides. The pelvic floor, which is the bottom of the barrel, you're going to hold one leg like that, and you're going to pull the other one away. So hold your legs together, hold together, and I'm going to pull apart. Don't let me pull apart. And so now we know he's got a weak QL, so the muscle on the back. He's got a weak oblique, the muscle on the front, again, 10 degrees up, pull across. And he's got a weak pelvic floor. Take a breath in, let it go. He doesn't have a ton of lateral excursion, so he's a candidate for a poor core, poor diaphragm, poor pelvic floor. He's going downhill, okay? So we want to address those. Once you start to strengthen him and he does the belt, you can come back and see if he's stronger. If the belt works or the strap works around the rib cage or the towel, then we should see improved strength in those muscles afterwards. Okay, we just did about 15 of these around the ribs to see what would happen. And let's check. Grab the sides of the table. So we're going to check the QL, pull. And that's noticeably better. There's some strength. I could probably overpower him. Let's try. Pull. He's doing well. Pull. And you can see he breaks a little bit. But considering that he only did 15 of these and that's all we did, that's pretty good. He's got hope again. I would follow up with that with some soft tissue, maybe here, down here, and even in here. Go back and watch one of the other videos for that detail, but I would probably do that first, maybe second visit, or have him do home care for that so that he can get that better. Let's check pelvic floor. Hold your feet together again, pull. Noticeably better. So we got a better pelvic floor, we got a better abdominal, we got a better QL, just from simple 15 simple repetitions in the strap, one time. That's pretty cool. What are some of the symptoms of a poor diaphragm specifically? You might get winded easily, you might have a poor breath holding time. Probably number one across the board is acid reflux or GERD. So we know that if you have those symptoms, especially with the acid reflux, you have to strengthen that diaphragm. So doing the rib belt before you're doing the exercises for the diaphragm, or for the core for that matter, is always a good idea. You want to get motion in the joints as much as you can so that you get as much benefit from the exercises and time you're spending doing them. Some other problems that you might have related more to the core than the diaphragm, but more than likely if you've got a poor diaphragm, you've also got a poor core. So you might have poor posture, back pain. Some you might not think of. Fibromyalgia is typically a problem with the diaphragm and breathing and the core muscles. So is low pH. A lot of naturopaths or chiropractors, alternative doctors do saliva testing for your pH. And a lot of times you'll see that low. And if it is, it's a respiration or a breathing problem, or a huge component of it is that. And we'll cover that in another video. As a society, we tend to look at people who have that six-pack and make the assumption that those guys have really strong abdominal muscles. And probably sometimes it's true, but more often than not it's not. I got a few of the runners that I've treated, and I got a bodybuilding friend that I've treated, and you make an assumption that because they have that six-pack, those muscles are strong as a rock. And like I said, oftentimes they're not. Some of the things you can do or look at these muscles is, why are they dysfunctional when they look so big or so strong? Oftentimes we get adhesions in these abdominal areas just like we get adhesions in other muscles. And so we have to sometimes go in and do some extra soft tissue work in these areas, not just a matter of using the rib belt, the diaphragm belt. So doing some soft tissue helps. Where do you do the soft tissue? Either where the muscle joins the bone, often, or where the muscle connects to another muscle, which is where it connects at a fascial point. So when you think of the abdominals, it's pretty easy. Under the ribs, we know that the muscles come up and attach to those rib cage, just like the diaphragm does. So working on the underside of the ribs is an area that's typically tender and responds well to soft tissue work. Just as well, at the bottom, just above the pubic bone, is where the other end of the rectus attaches. And so it's oftentimes very tender as well. Less obvious places are right in the middle where the abdominals come together, and there's a fascial layer that goes right down the middle where they attach. So if you come just off center and rub in there, you'll often have very tender places along the way, and those are the places you want to focus at. And then the lateral portion of the rectus, where the obliques come in and tie in, is often very sore. So down the sides, on the side of the rectus, dead middle just off center, under the ribs, top of the pubic bone, are great places to work adhesions, probably for the first week or so, maybe 2 weeks, and then following up consistently with the rib belt tends to get those abdominal muscles working real well. So when you put your strap on, the rib belt or the diaphragm belt, you want to basically have it right where the pen is. You don't want to have it right up to the xiphoid. You want it right across those lower ribs. Okay? Now, the abdominals and the diaphragm attach on the bottom of these ribs. So now you can kind of start to understand how important rib motion is to the function of these muscles. Okay? Then it goes down and attaches, the bottom of the abdominals attach on the pubic bone and on this part of the bone here called the ramus. So this is where you want to rub to see if it's tender. And you want to rub these when your knees are bent because they won't hurt as much. Okay? Now we're going to take a look at the muscles attached to those bones. So again, when we're doing soft tissue, the areas that we want to focus on are under the ribs where the abdominals attach, okay? The very top where the abdominals attach, okay? Down on the bottom of the pubic bone, okay? Now, here's a really important thing. You get these oblique muscles that come together. You get the external, the internal, and the transverse oblique. And they all come in together, and they attach on the side of the rectus on this thick band of fascia. So this is the area you want to treat, again, along with under the ribs and top of the pubic bone. Okay, so here's a cross section. This is your rectus abdominis, and this is that band of fascia. And so you have three different abdominal muscles or obliques coming in. Obviously the one on the outside is called the external. Next one in is called the internal. And the last one, and probably the most important oblique muscle, is the transverse. So these three muscles come in and connect with that fascia where the rectus stops. So working on the soft tissue there oftentimes facilitates the function of those three muscles. That's why it's important to work on that lateral band area.